So, what's the number one most dangerous side effect of blood pressure drugs? The one that you won't find on the label. First, an overview of the 8 classes of high blood pressure drugs, how they work, and their common listed side effects. First, ACE inhibitors. ACE inhibitors prevent your body from making angiotensin II, a natural substance our bodies produce that, among other things, can cause our blood vessels to narrow, thicken, and stiffen. Angiotensin II also triggers the release of a hormone associated with increased water and sodium in the body. The most common side effect is a dry cough, but rarer side effects include lightheadedness, dizziness, rash, reduced appetite, increased blood potassium, changes in the flavor of foods, and swelling. ACE inhibitors are also associated with birth defects. Some pain relievers reduce the effectiveness of ACE inhibitors. Two, alpha blockers. Alpha blockers stop the hormone norepinephrine, also called noradrenaline, from constricting the muscles that surround the veins, smaller arteries, and other muscles throughout the body. Side effects include first dose effect. When first taking alpha blockers, some people get dramatically reduced blood pressure, dizziness, and feeling faint when sitting up or standing up. Additional side effects include headache, pounding heartbeat, nausea, weakness, and weight gain. Three, angiotensin II receptor blockers. These drugs block the action, but not the production, of angiotensin II. Side effects, although relatively rare, include diarrhea, dizziness, headache, lightheadedness, back and leg pain, sinus congestion, kidney failure, liver failure, allergic reaction, lowered white blood cells, and swelling. Angiotensin II receptor blockers are also associated with birth defects. Four, beta blockers. Beta blockers block adrenaline, also called epinephrine, causing the heart to slow and blood vessels to open. Common side effects include cold hands, dizziness, fatigue, and weakness. Less common side effects include depression, reduced libido or sex drive, insomnia, trouble sleeping, and shortness of breath. Beta blockers may cause severe asthma attacks. They can also block indications of low blood sugar like a racing pulse and diabetics. Beta blockers can affect cholesterol and triglyceride levels, typically temporarily. Abrupt discontinuation of beta blockers can increase risk of heart attack and other heart issues. Some physicians see a link between beta blockers and an increased risk of heart disease. Five, calcium channel blockers. Calcium channel blockers inhibit calcium ions from getting into the cell walls of the heart and the muscles surrounding blood vessels, causing them to relax. For a muscle to contract, it needs calcium ions to cross its cell membrane. Common side effects include constipation, drowsiness, flushing, headache, nausea, rapid pulse, and swelling in the lower legs and feet. Some calcium channel blockers react with grapefruit and foods that contain grapefruit by blocking the liver from properly removing them from the blood, resulting in the potential for dangerous concentrations. Six, central acting agents. Central acting agents work directly in the brain, blocking signals to speed up heart rate or constrict blood vessels. This class of drug is less commonly prescribed due to strong side effects. Side effects include constipation, depression, dizziness, dry mouth, drowsiness, fatigue, headache, impotence, impaired thinking, and weight gain. Abrupt discontinuation can cause dangerous spikes in blood pressure, especially when taken with a beta blocker. Seven, diuretics. Diuretics come in three classes: thiazide diuretics, loop diuretics, and potassium-sparing diuretics. Diuretics work by causing the kidneys to excrete sodium and water in the urine, resulting in less fluid in the blood and hence lower blood pressure. Side effects include increased urination. Now, this is most common with loop diuretics. For some people, this subsides within a few weeks. Too much potassium in the blood. This happens with potassium-sparing diuretics. Too little potassium in the blood. This happens with thiazide diuretics. Breast enlargement in men, increased blood sugar, increased cholesterol, erectile dysfunction, impotence, rash, gout, which is joint inflammation, and menstrual irregularities. Some physicians associate diuretics with an increased risk of heart disease. Eight, vasodilators. Vasodilators cause blood vessels to open. Their precise mechanisms are not fully understood. A common one, hydralazine, is thought to interfere with calcium ion release in the muscles that surround blood vessels, causing them to relax. Another common one, minoxidil, contains a nitric oxide element that may trick blood vessels into opening. Side effects include chest pain, dizziness, flushing, headache, fluid retention, heart palpitations, nausea, sinus congestion, racing pulse, vomiting, and excessive hair growth. So here's a fascinating side note. You've heard of Rogaine? It's called Regaine in some countries. The hair growth product that you see on TV? In one of the classic stories of a drug being made for one purpose and its unintended side effect being sold for another, Rogaine is just repackaged minoxidil. In a similar story, there was another high blood pressure drug that flopped in clinical trials, but it did have some rather unexpected side effects: Viagra. So, what's the number one most dangerous blood pressure drug side effect? The one that you won't find on the label. It's complacency and a false sense of security. Blood pressure drugs treat the symptoms, but they don't treat the deeper causes of the symptoms. For example, if someone isn't managing their stress, the blood pressure medication becomes an enabler, merely allowing deeper stress issues to compound. With the underlying cause untreated, the need for the drug increases. Now, wouldn't it make more sense to treat the cause first? There is indeed a minority of people who, despite using all the natural ways to control blood pressure, are still best off taking blood pressure medications. For the rest, the question must be asked, what deeper dangers are the drugs merely masking, and at what expense to their whole health picture? The drug information in this article is an informative overview only. It's not intended to be a diagnostic tool. Your healthcare needs are unique. Please talk with your physician about the treatment options best suited to your individual needs. To learn more about natural ways to lower your blood pressure without drugs, visit us at lowerbloodpressuredrugfree.com.